Hey, I'm Morgan Brown and this is my final English video. So diving right in, I'm going to talk about the problems in occupational therapy, and the one I'm going to focus on is that not every patient can be healed/cured in the way that they are hoping to be. This can be very heartbreaking for the patient and occupational therapist. I also think many people aren't informed or educated at all on what occupational therapy is, and without that information, they oftentimes aren't exposed to it. And when they aren't exposed to it, they can't use it to help themselves become better. To put in perspective, occupational therapy is described as therapy that restores, reinforces, and enhances the abilities of those who are injured or diseased to care for themselves, return to work, avoid other injuries or disabilities, to care for themselves, return to work, and avoid further injury, and so forth. And this is done by using activities, play, work, or anything that can help them get into their everyday life activities again. Now that you know what occupational therapy is, a little bit of history on it is that it was beginning to be used during World War II, and World War II actually ended up having one of the higher survival rates because of occupational therapy. So now you might think, since there was a higher survival rate due to occupational therapy, how was there heartbreak and room for fault? Well, occupational therapy requires a master's degree most of the time, and sometimes school is really hard, and if someone doesn't understand something, they might be embarrassed and not ask questions and just learn incorrectly, and that can lead to them not knowing what they're doing in their work field, and that can be very frustrating for patients, coworkers, family of the patient. This can also be really frustrating for the occupational therapists themselves. They've been going to school for years and years, and then coming back and them not knowing how to do their job can just be so frustrating. And the reason people often use occupational therapy is to get back to their original state and become independent again. Occupational therapy is used for all ages. They could go from a newborn to someone at the end of their life. That proves how occupational therapy is so diverse and uses so many different strategies, because the way you would help a newborn wouldn't be the same way you would help a middle-aged man. And using all these different strategies is a lot to remember for someone going through school, and there's just so many things to remember. But it is important that when you're working in the field that you know what you're doing and that it is done correctly, because it's not fair to anyone for an occupational therapist to be getting paid with no improvements. And when the patient isn't improving, they're often blaming the occupational therapist, which, based on what I just said, that is the main reason that I could see blame being put on the occupational therapist. But besides that, it could be lack of ability after an accident. It could be not having the mental ability to be able to get through it. It could just be a bad attitude. There are so many factors that could incorporate why the patient isn't doing as well as they were hoping. And when an occupational therapist is blamed for not being able to help their patients, the patients will stop coming in and occupational therapy will just no longer be in use. One of the biggest factors that I think causes the patient to become frustrated and no longer willing to follow through with occupational therapy would be that they can't see their improvements. In occupational therapy, you work with small muscles, and the improvement, it will look like a turtle in a race. It's an extensive process, but in the end it's meant to be worth it. I have an analogy I really like to compare this with, and it's knowing that when you look in the mirror every single day, you feel like you look the exact same. Yet when you look at a picture of you from 10 years ago, you laugh because you look completely different. I feel that this is the exact same because it's just a very slow process and you don't see it as it's happening, but then in the end, you can see where it is. A way that can help with fixing this is to record every single day where the patient is at, so you can say, look, this is where you were at a week ago, and that can keep the patient from becoming discouraged. I believe that occupational therapy is very helpful and important to have in the healthcare setting because it helps a lot of people through a lot of problems. In my research, I've also found that people that are occupational therapists either love or hate their job, but more ended up loving their job than hating it. So I see a lot of positive things that could come out of going into this profession. The most complicated part about this dilemma is that it'll probably never fully be fixed because it depends on people and their attitudes, and everyone's always going to have their own opinions and attitudes, and some things just never change. We can cross our fingers forever, but it probably will never improve how people see occupational therapy in this way because it can be really hard to see their improvement, and some people just have a hard time seeing how far they've come. It's hard for some people to look at the big picture, but the little things that make up the picture are also so important and they're often missed. I believe that it is super important to keep occupational therapy around. I think this because it is used for so many different people, so many different ages, and there have been funds for it found in so many different ways. It's so important to be able to help people be the best they can be. Occupational therapy helps with mental disabilities, physical disabilities, geriatric disabilities, developing disabilities, and things that just don't work with the body. It helps with so many different things that I think it is so important that we use it. I really think it's important to be patient with our patients because sometimes they go through very hard things that make them have to use occupational therapy. Like if they're in a terrible accident and they're trying to recover to become the way they used to be, that can be very hard on anyone. If the world could just take a step back and look at a big picture and have positive attitudes and be very thankful for all the help that they're getting and appreciate everyone in their lives who are trying to help them, then this problem could somewhat become solved. There's no reason for anyone to be so rude or disrespectful or to point fingers for things that can't be explained. The key to this being a very happy and helpful experience is a positive attitude. And I think that occupational therapy is very important, and if anyone can be open-minded, it will be a great career for everybody.